If you're suffering shoulder pain or been diagnosed with shoulder impingement, stay tuned. In this video, we're going to give you 5 of the best evidence-based exercises to start getting your shoulder feeling better and get rid of the shoulder impingement. Let's get into the video and take a look. Well, welcome back to another episode of Physio Tips with Mauro. I'm your host, Mauro Burnett. For those of you that don't know me, I'm a board-certified orthopedic specialist in physical therapy and the owner of Australian Physiotherapy Specialist Physical Therapy Center located in Jacksonville, Florida. For today's video, we're doing part 2 on shoulder impingement. We just released part 1 on shoulder impingement a little while ago, and we discussed shoulder impingement, the definition. We gave you some strategies on how to stretch your shoulder and how to get some of your passive range of motion back. In today's episode, we're going to move on to phase 2. Phase 2 is starting to strengthen the rotator cuff to give you a better mechanical advantage when you're lifting your arm overhead so that you don't keep pinching your shoulder. To kind of go over shoulder impingement, let's talk about what's going on behind the scenes. If you have a weaker rotator cuff muscle, what can happen is when you go to lift your arm overhead, as you start to lift, the arm bone, the humerus bone, can slide upward into the shoulder socket. And as it slides up, there's some bursa, a little sac of fluid that protects the tendon, as well as a rotator cuff tendon that's inside the shoulder joint. As your arm starts to go up, if it slides too far up, it pinches that tendon and pinches that bursa. If that happens, it's going to cause some irritated soft tissue. If it continues to impinge, it eventually could cause bursitis or even chronic tears in your rotator cuff tendon, which could lead possibly to a tear in your rotator cuff tendon. So it's a serious condition that we want to treat. If we treat it early, that's the best way to go. Some researchers have put shoulder impingement as anywhere from 1/2 to 2/3 of almost all shoulder complaints can be tied back to this dysfunction. There's multiple things that can cause shoulder impingement. One would be tightness in the shoulder. On our first episode, we covered how to stretch out some of that tightness. That gives you a restoration of how the arm is supposed to move into the socket a little better. But dynamically, the 4 rotator cuff muscles, the muscles that really control stability of the shoulder, their job is to pull down on the humerus bone while your deltoid is lifting your arm up. If everything works properly, then when your deltoid is lifting your arm, the rotator cuff keeps the humerus bone where it's supposed to be and it doesn't let it ride up excessively. That keeps clearance, and your rotator cuff tendon and your bursa end up doing pretty well without being pinched. So today's video, we're going to give you 5 of the best evidence-based exercises to really strengthen up those rotator cuff muscles and your scapula muscles. A third component of impingement, I mentioned tightness of the shoulder, we mentioned rotator cuff weakness, but a third and very important component is what's called scapular dyskinesis. Scapular dyskinesis is where you're having weakness of your shoulder blade or scapula muscles, and that leads to a poor rhythm the way the scapula and the arm lifts. You're supposed to have a 2-to-1 ratio. For every 2 degrees of arm elevation, there's 1 degree of shoulder blade or scapula elevation. Weakness in the scapula can lead to this scapular dyskinesis, which then causes impingement due to that altered rhythm. So let's get into some of the exercises. We're going to address getting the rotator cuff stronger. We're going to address some of those important muscles of the scapula, get rid of the scapular dyskinesis, and get you back to doing the things you love without pinching your shoulder. Let's get into exercise number 1. First, this exercise, side lying with external rotation, we take a small weight and a towel underneath the arm, and then you raise your arm up level with the horizon, slowly lower it back towards your stomach. You would do 8 to 12 reps. Possibly 2 to 3 sets of 10, and you could easily do this 2 to 3 times a week. It's a great exercise for strengthening your external rotators like your teres minor and your infraspinatus. Great exercise. Give it a try, but keep it pain-free. All right, for this exercise, it's abduction at 100 degrees with external rotation, which means my thumb is up. Again, I've got a small dumbbell. I'm lifting my arm to the side. You can do this off the edge of your bed. Maybe 8 to 12 reps, 2 to 3 sets of 10. This is a great exercise for your supraspinatus tendon. Notice I'm drawing the shoulder blade up a little bit and then elevating. Fantastic exercise. Definitely one of the top 3 best exercises for supraspinatus. Keep it pain-free, and we'll give it a try. For this next exercise, we're going to do what's called scaption. In this case, I've got a couple 5-pound dumbbells. But choose whatever dumbbells feel good for your shoulders. Make sure it's pain-free. Maybe it's 2 or 3 pounds to start with. But I'm going to bring my arm up at kind of a 45-degree angle out to the side. Not all the way in front, not all the way out, but it's kind of splitting the difference. This is called the plane of the scapula. This is a fantastic exercise for re-strengthening your supraspinatus muscle. This is one of the rotator cuff tendons that get torn when you have impingement. Go slowly, make sure it's pain-free. Build up to where you could do anywhere between 8 or 15 reps, 1 to 3 sets of 10, and this could be a great exercise you could do 2 or 3 times a week to strengthen that rotator cuff muscle. Most research studies, when looking at scaption, usually list this as the top 5 best shoulder exercises all around. All right, let's get into the next rotator cuff exercise. For our next exercise, we're going to do a row with external rotation. This is a fantastic exercise for your middle and lower trapezius muscles between your shoulder blades, as well as your rhomboids between your shoulder blades. And it's pretty good for the posterior deltoid and your external rotator cuff. Fantastic exercise. I think it feels really good. Make sure it's pain-free, of course, for you. Build up to where you could do anywhere between 8 and 15 reps, 2 or 3 sets of 10, and that's a great exercise that you can start doing 2 to 3 times a week. All right, let's get into our last exercise. All right, for our last exercise, exercise number 5, what we're going to do is called the push-up with a plus. I've got my resistance band kind of around my back, underneath my armpits, high up. And what I want to do is extend my elbows out. And instead of being 90 degrees, I might even go more like 100 degrees. And then what I'm going to do is punch out that last little bit. Hold it for 5 seconds and then gently relax. Elbows extended, 100 degrees, slightly push out, hold, and back. This is a great exercise for your subscapularis muscle. Your subscapularis muscle is the largest of your 4 rotator cuff muscles. It's the main restraint to not let your shoulder go too far forward, and it helps prevent dislocations. This exercise is fantastic for your subscapularis as well as your serratus anterior, very important shoulder blade muscle that helps with that scapular dyskinesis that we talked about. All the way out. The 100-degree angle is kind of nice. Studies show when you do it at a little bit more than 90-degree angle, more like 100, 110, you get less upper trap tightness. Less upper trap tightness allows you to be able to get more of your serratus anterior and less of this unwanted overactivity of your upper trapezius. Lots of clinical studies on shoulder pain has shown you have overactive upper traps and you have underactive serratus anterior. So this is a great solution to that problem. Elbows fully extended, 100-degree angle, punch out, hold for 5 seconds. Again, build up to you could do 10 or 15 reps, 2 or 3 sets of 10, and a 2 or 3 times a week exercise. Super exercise for the subscapularis and for your serratus anterior. Well, thanks for tuning in to today's video on part 2, helping shoulder impingement. I hope you got something out of it. Remember, don't forget that you can hit that subscribe button below so you can receive more videos like this in future on physical therapy related tips. Well, it's goodbye for now, and we're going to see you next time on Physio Tips with Mara.